Imagine waking up in a hospital bed after jaw surgery following a severe car accident. Your jaws are wired shut and you have to be on a strict soft food diet for 2 weeks, only to find out you need surgery again because of implant failure. This means more anesthesia, more costs, and more recovery time. Jaw fractures, also known as mandible fractures, are fairly common, affecting 21,000 people in the United States alone every year. Vehicle accidents and physical fights are the leading causes of jaw fractures, affecting 1 in 100 car accident victims.
The current medical intervention is mandibular fixation, where a plate and screw system is implemented to hold the fractured bone pieces together. Surgical complications are very common, occurring approximately 11.4% of mandibular operations. One of the major obstacles to the procedure is selecting the appropriate screw length, ranging from 4 to 19 mm for each patient based on their unique bone anatomy. The length of the appropriate screw is determined with the insertion of a depth gauge into a pre-drilled hole.
However, the oral cavity has a very limited space to work with, making it hard to align the depth gauge. As you can imagine, lossing someone else's wisdom teeth is a challenging task. The current depth gauge is also difficult to maneuver and often slips during engagement. These factors result in surgeons often skipping this difficult and time-consuming step, relying on experience to make an educated guess, which decreases the accuracy of screw length and thus increases the post-operative complications, such as infections and the need for a second surgery due to implant failure.
This is where Team Jaw steps in. We have developed a new depth gauge, the Engage, featuring a double hooking mechanism that hooks onto the bone for a more stable insertion and more effective engagement that utilizes single-hand operation. Our device is composed of 4 main compartments: the body, the rod, the V-hook, and the buttons.
The body encompasses the rod that guides the V-hook along the pre-drilled hole for insertion and retraction. The buttons, ergonomically located on the tip of the body for easy access during single-hand use, activate the V-hook. For insertion, the buttons are pressed, allowing for the tip to fit into the hole. Then, the buttons are released to allow for the bones to maintain the compressed state of the V-hook. Once the hook exits the bone, the lack of restraint from the bone will allow for automatic hook engagement with haptics to the user. During retraction, engagement is released by pressing the buttons again, allowing for the user to pull back and retract the device from the patient.
During development, different wires and length of the V-hook were used to optimize the device performance of haptic alerts to the users using 4th gauges. Further, interface between the different device compartments was refined to better fit the user's hand through numerous 3D prints using PLS and resin. Validation testing performed on wood boards as well as with T3 Labs on a pig cadaver suggested that Engage takes single-hand measurements within 15 seconds on average with a 1 mm precision.
Our depth gauge is not only limited to oral and maxillofacial, but also orthopedic and ear, nose, throat surgeons, broadening the influential outreach of the Engage to surgeons of various specialties and hospital branches. The Engage is projected to cost $26. Targeting all mandibular fixations, the serviceable market is approximately $550,000, and broadening to all orthopedic sectors that use depth gauges, the total addressable market is approximately $4 million in the US alone. By accommodating for the various anatomical scales, our technology can be adapted to fit the needs of other surgical departments and orthopedics outside of facial reconstruction, such as spine and joints.
With our successful prototype, the next step will be to go from the prototype to industrial products, which involves incorporation of more ISO standards such as ISO 11135 for ETO sterilization, as well as packaging for single-use medical products, manufacturing pipelines, and marketing. As a FDA Class 1 device, the device is 510(k) exempt. However, more detailed validation and verification are needed to meet manufacturing standards and to upscale outreach in order to bring this device to the market. Engage provides a single-handed tool for faster measurements during mandibular fixation procedures. With Engage, our team strives to increase the speed and success of the mandibular measuring process and ultimately decrease post-operative complications.